Okay, hi everyone. Welcome to Facebook Live. Today we're going to talk about AFib ablations. And sorry for being a few minutes late, but I'm excited about this topic because as I was thinking about AFib ablation and its role in how to help people with atrial fibrillation, I realize how grateful I am that we have tools like AFib ablation these days. You know, when I was first an early doctor when I was doing my residency at Mayo back in like the late 90s, we had the treatments we had were like quinidine and procainamide, and there's probably a reason why you've never heard of these is because we don't use them anymore. They just didn't work very well, and now we have really much better medications, although as we'll talk about, medications still are pretty limited, but we also have ablation, which again also has its limitations, but is a much better option than we used to have, say 20 years ago. But I want to talk about AFib ablation and really kind of give the whole picture about this. And as the title said, is AFib ablation a magic bullet or a band-aid? And what I'm going to show you is that it can be both. And so if you had an AFib ablation or you're thinking about having an AFib ablation, I'd love to hear your experiences, your concerns, your comments. So leave a comment below. We'd love to hear from you. So we all know the concept of atrial fibrillation. That's a problem when people are in atrial fibrillation. A lot of times they don't like being in atrial fibrillation. While not everybody has symptoms of it, if you do have symptoms from atrial fibrillation, you do not want to have it. And so that leads you to go and find somebody that has expertise in how to treat this, usually electrophysiologist, and they apply either ablation or medications or both as part of your expert medical care. What the goal is to get you back into regular rhythm or to sinus rhythm. But we all know that there is also there's a risk of going back into atrial fibrillation. And how big is that risk? Well, it depends on a lot of factors. It depends on how long you've had atrial fibrillation, what's the underlying causes of atrial fibrillation, all of those things. That really is a discussion between you and your doctor as to what the chances of success are. But we do know that even under the best of circumstances, there's going to be a percentage of people that go back into atrial fibrillation. So what is that number? Well, you'll likely hear a lot of different numbers thrown around with this. And if you've had an ablation, likely your electrophysiologist has said that your chances of success with that ablation may be 80% or higher. But it's also important to understand, well, what time frame are we talking about? How are we defining success in this? And usually when electrophysiologists are talking about 80% success rate, they often are thinking that's over about a year's time. But, you know, for most of us, a year, yeah, that'd be great. But what about longer periods of time? Well, we do have some research data that shows us some of that information. One of the best is called the Cabana trial. This is the biggest study for people with atrial fibrillation that comes and goes, the paroxysmal atrial fibrillation. And the concept of the study was, are medications better for treating atrial fibrillation or is ablation better? And of course, we knew the answer before this. We knew ablation would be better, but this was a study to definitively show how superior ablation would be to medications, at least from a non-electrophysiologist like me. That seemed to be the concept of the study. So what they did is they had over 2,000 people in the Cabana trial. They were randomized to either medications or ablation. And there's some complexities here because some people in the medication part got ablation, some people in the ablation part only got medications. It's kind of the way the trial was designed, but still a huge trial for atrial fibrillation ablation, 2,200 patients. Follow up also really critical. They went 4 years, so this was not a 1 year trial, this was a 4 year trial. And what they found was that those people who were assigned to the medication arm of atrial fibrillation, over 70% of them had recurrence of their atrial fibrillation in 4 years' time. So over 2 out of 3 people, if they were only treated with medications, or some of them, I think it was in the 20%, maybe it was 29% of people actually had ablation as well, but the chances of them being free of AFib over 4 years was less than 30%. So, ablation, of course, is a lot better than that, but how much better was it? Well, it wasn't dramatically better. I mean, it was improved. It went from about a 30% chance of having no AFib at 4 years to about a 48% chance of having no AFib after 4 years, but still not a dramatic improvement in this. And I should also say that there was other findings from the Cabana trial that showed the ablation to be better. One of those was how much less burden of AFib people had. I think that it was somewhere around 90% less AFib overall. But if we're looking at something very specific, like did you or did you not have any evidence of recurrent AFib, then the chances of success with ablation in this large trial done at the best medical centers in the world was somewhere around a 50-50 thing. Another important point about this, and what the Cabana trial, wanted to do, I shouldn't say. I mean, all sciences, we have a question, but the question was, is ablation better than drugs or medication therapy for the big things, for preventing death, for disabling stroke, serious bleeding, or cardiac arrest? And the findings from the trial showed that there were no difference between the people that were treated with medications versus those people that were treated with ablation. So in one sense, I guess this is a little bit humbling, right? I think it's humbling for all of us in cardiology. We like to fix people. I think that was one of the things that really drew me to cardiology when I was in training and trying to decide what kind of doctor I wanted to be. I loved it in cardiology. We had tools that actually fixed people a lot of times. But it turns out that ablation isn't always the fix that we would like for it to be. But I think when you take a step back and look at why that is, it's almost remarkable that ablation is as good as it is. Because while we all understand this concept of AFib, ablation, expert medical care, achieving sinus rhythm, but if we do not address the underlying causes of AFib in the first place, then AFib ablation is not a miracle cure. It is a band-aid. It is only covering up the problem and not addressing the underlying issue. So what are the causes of AFib that we can change, that can change the outcomes, change the likelihood that you're going to have failure with AFib medications or with ablation, or maybe even not need ablation at all in the first place? Well, these are the ones that are most prominently discussed in the research literature and are addressed in programs like ours, where we help people transform their health so they can get the best outcomes from AFib. So the biggest one is unhealthy weight. So what's unhealthy weight? I think that's a bit of a nebulous term or vaguely defined term, and I think that's okay because unhealthy weight can be different for different people. In research studies, it is a BMI or body mass index over 27. And you can go to an online calculator if you're interested in what yours are. It does not mean that everybody with a BMI over 27 has unhealthy weight. That's not it at all. And in fact, it doesn't even mean that if your body mass index is below that you are at a healthy weight. There are some people with smaller frames that even a BMI in the high normal range may be too high for them. So, but as part of a research study, we have to keep things kind of easy to define, and that's the research definition. The unhealthy weight is a big driver of the AFib epidemic we have. The other part, of course, is we're getting older as a population, but when you look at like our last week's Facebook Live at, the graphs of the obesity epidemic with the AFib epidemic, they correlate very strongly. Maybe not cause and effect, but I think when we understand the physiology, we can make a really strong case that they are cause and effect. And especially when you look at how things change when those people lose weight, which we'll talk about here shortly. Sleep apnea, I think anybody with AFib needs to think about this. About 50% of people with AFib have sleep apnea. maybe 80% of those people don't know it. And if you have untreated sleep apnea and AFib, you have a driver for your AFib that is not going to go away. So if you have any concerns about having sleep apnea, loud snoring, don't wake up feeling rested, you have a partner who says you stop breathing in the middle of the night, I really encourage you to talk to your doctor about the options for maybe getting tested or finding out if you have sleep apnea and then seeing if that's worth treating. Um, Tobacco, I think, is pretty self-explanatory. Smoking is like pouring gasoline on the fire of heart disease and stroke, and it's something that certainly should be addressed if you're smoking. But alcohol is the one that I think is more commonly a driver of atrial fibrillation and less commonly recognized. So we've always thought moderate alcohol has been a drink a day for women, 2 drinks a day, up to 2 drinks a day for men. More recent research suggests that that's not the case at all, and especially not for atrial fibrillation, that maybe the best amount of alcohol for those with AFib is 0, or at least less than 2 drinks a week. And we'll talk a little bit about that as well. Blood pressure. 46% of American adults have high blood pressure. Less than half of them have that under control. Major risk factor for AFib, strong driver for more AFib, but maybe more importantly, a strong predictor of heart attacks and strokes. And about 1,100 people a day die because of high blood pressure not being well controlled. Something that we know how to take care of. We're just not doing it in some cases. Low quality diet, maybe 60+% of the American diet is highly processed foods. I personally believe that that is the biggest factor in our obesity epidemic, and we'll do something, talk about that in more detail down the road. And then being inactive. So about 25% of people meet the minimum recommendations for physical activity. That's 150 minutes a week of moderate activity, 75 minutes a week of vigorous activity, plus 2 sessions of strength training, resistance training, core strength training. Only about 25% of people get that. In one of the studies, I won't talk about it too much today, but we'll talk about it more in the future with AFib, those people who were able to get more fit in the 4 years of their studies, they lowered their risk of being free of AFib. I'm sorry, they increased their chances of being free of AFib without medications by about 45%. So a really strong cause of atrial fibrillation. So all that's well and good, but what's the real impact of this? I think that's the next question. So okay, you might understand, you might look at these causes of AFib, and you might see some, 1 or 2 or several that apply to you, but what's the value of addressing them? Like, are they going to make things a little bit better? They're going to make things a lot better. Well, we know the answer to that as well. So I'm just going to present this one study. It's called the REST AF study, and this was beautifully done. They took all the people in the study had Afib ablation, so they all had Afib. They all met indications for atrial fibrillation ablation, and they then looked at the people that were just treated with expert medical care, so medications and ablations alone, and you can see that at 4 years, only 18% of people in the study were free of AFib after 4 years. So these are low numbers. Recognize this study was published in 2015. They had to do the data before that. So this is really like late to like 2007, 8, 9, 2010 medical treatment for AFib. We're better than that now, and maybe this number now today would be more like 50% or 40% or something like that. But at the time of the study, this is what they got. 18% of people were free of AFib. But what was the benefit of treating the causes after ablation? How much more likely were those people to be free of AFib at 4 years? So I want to just define what treating the causes of AFib was in this research study. One was that the goal was everybody's blood pressure would be less than 130/80. Next, they'd have an LDL cholesterol. Sometimes people call that the bad cholesterol. They'd have an LDL cholesterol less than 100. Weight loss, we'll talk more about that, but that anybody that had a body mass index over 27, that their goal would be to lose weight. They would have their blood sugars well controlled. Hemoglobin A1C is like a long-term measure of blood sugar. Over 6.5 is consistent with diabetes. Less than 5.6 is normal range. That they were all tested, and then if they had sleep apnea, treated for sleep apnea. If they smoked, they got counseling on how to quit. The goal was less than 2 alcoholic drinks per week, not per day, but per week. And then, although it wasn't part of this study, the CardioFit study that we'll talk about at another time, included being more physically active, getting more fit. And what they did, what their goal was there, is that they started everybody at 20 minutes of physical activity 3 times a week, and then slowly increase them up to a goal of 200 minutes a week of exercise. And as we talked about, that added further on top of the benefit of weight loss and treating these other causes. So what was the benefit of treating those causes in the REST AF study? Well, if it was 36%, that would be double. Was it 54%? It'd be triple the benefit. All of those would be amazing, but what it was 87%. So those people who got expert medical care, ablation, and also treated the causes of their atrial fibrillation were 87% likely to be free of AFib at 4 years, compared to 18% if they didn't treat those causes. So really remarkable benefits. The other thing I want to emphasize is that those people that treated the causes also were able to take a lot less medications. So, I talk about this issue because I know it's prominent for my patients. It is for me as well. Like nothing that I like better than when I can take people off of medications and they feel better. Like that's a win for me. That's a really gratifying thing. And I don't want to take medications as well. So I think this is an important topic. I want to emphasize, though, I'm not talking about blood thinner medications here for stroke prevention. Those are critically important. If you have AFib or have off and on AFib and you're at high risk for a stroke, this does not mean stop your blood thinner medications. That's a really bad idea. Those are life-saving medications. What I'm talking about here are the rhythm medications, the medications that help people stay in regular rhythm and not go back into AFib. So these would be medications like amiodarone, sotalol, flecainide, propafenone, those type of medications. So if they treated only with medications and ablation, about 42% of the people were on AFib medications at the end of the 4 years. But if they treated the causes, then only 16% of the people. So, what is that? About 2.5 times less chance of being on these medications. And I will tell you, nobody likes taking the AFib medications unless they really have to be on them. If you don't want to take the medications or you really would prefer not to, here's your opportunity. Here's how you can do that, is to treat those causes. So to answer the question that I started with, is Afib ablation a magic bullet or a Band-Aid? The answer is yes. And so it can be the magic bullet. Like if you look at these causes of AFib and you don't have any of those causes, but you have AFib, then ablation could be the magic bullet for you. And it does happen. I mean, there's some people that have a genetic predisposition to atrial fibrillation. There's just some people that have, twitchy cardiac cells that in their pulmonary veins that they need this ablation procedure to be able to isolate those and fix their AFib. For those people, then this is a magic bullet. Like this is an incredibly effective therapy, and I'm so grateful that we have that. But if you take a step back and you have AFib and you don't want to have AFib, and you look through these causes and you have 1, 2, or more of these causes, then you have to recognize that ablation procedure is likely abandoned. And, also I'll point out too that although these studies are long-term for a study, like a 4-year follow-up for a study is a pretty good long pretty good follow-up for a study. Like these are really expensive studies to do, and it takes a long time for us to get those results and spend a lot of money. But from a life standpoint, if you're in your 40s, 50s, 60s, 70s, even 80s, you probably want more than 4 years. Likely you are interested in what's going to happen after that. And I will just tell you that if you just rely on the ablation and the expert medical care, they don't get better. They just continue to get worse. So I'll end with this. This is the results of the people in the AFib study that we talked about that did get the expert medical care, plus they treated the causes. What happened to those people? Like, what were their outcomes? Here's what happened to them. First, the average person lost 29 pounds. So pretty remarkable. This is a pretty dramatic weight loss. Their blood pressure went from 160 to 126. So a 34-point drop in their blood pressure. The poorly controlled diabetes, when the study started, 9 people in the treat the causes group had poorly controlled diabetic numbers. Hemoglobin A1C over 7. At the end of the study, none, 0. All people had really well controlled blood sugar numbers. They took 72% less AFib rhythm meds. Again, these are the amiodarone, flecainide, sotalol, propafenone. 72% decrease in that, and a 20% decrease in their blood pressure medications. I'm frankly surprised by this number, because not because it's lower, but because it's not even more impressive. I will tell you from my clinical experience, when I have patients who have high blood pressure and they lose weight, get more fit, treat sleep apnea if they have it, minimize their alcohol if they're drinking alcohol to excess, their results are dramatic. Like being able to, in some cases, get off of blood pressure medications, and I don't want to promise that for everybody when I see them, but certainly on a minimum amount of blood pressure medications. Blood pressure, there's a genetic component to it, but the biggest component, the biggest driver for blood pressure for most of us is our lifestyle choices. And if we can treat those things, then oftentimes the blood pressure certainly gets better, and in not an insignificant number of cases actually gets cured. So I'll end with this. If these are topics that you're interested in, if you recognize that you have some causes of AFib, that you have an opportunity to dramatically improve your AFib outcome, then I would invite you to check out our free workshop, the 3 truths everyone with AFib should know who wants to avoid more ablation and medications. You can just put workshop in the comments below, and my amazing health coach assistant, colleague, friend Rylan will send you a link to watch this workshop. It's about 20 some minutes as it is right now, and if you watch that and it really makes sense to you, and you are in that situation where you're saying, look, this is a problem I need to fix. I'm not willing to wait anymore. I need to fix this now. Then schedule a phone call with Rylan and I, and we can talk to you about what we could do. See if you're a person that we can help, and if we can, we'll certainly offer you the opportunity to work with us and achieve the things that you're looking for. But that'll be the first thing that we want to do, is find out what exactly is the problem for you, what's the pain that it's causing you, what could it be if you did solve this problem. So I would love that. Look forward to talking to any of you. And next week, join me again Thursday. We'll do this at 11 o'clock, not 11:05, I hope. But I'm going to talk about the real cost of AFib. And, we're going to talk about the medical costs. We all know about the increased risk of stroke and heart failure, dementia, and death. 2 times risk of being hospitalized if you have atrial fibrillation. But I also want to talk about the financial costs of atrial fibrillation. And I'll just give you a little preview of that the most recent study that looked at the cost of atrial fibrillation for those people who have AFib versus those people who do not, what would you think the average increase in healthcare costs would be over 1 year? So 1 year. What do you think it'd be? I mean, I think even a couple $1,000s would be pretty dramatic. It's actually a lot more than that. It's over $18,000 every year having AFib versus not having AFib. So we'll talk about the real cost of AFib next week. And the goal of that, of course, is not to strike fear into people, but to show you the opportunities where you can take control of this and not put yourself at that risk unnecessarily. So thank you so much for joining me this week. I love doing these Facebook Lives. Send me any comments or suggestions that you have, and I look forward to seeing you next week. Have a great week.